Good afternoon. I'm your host, Cindy Welch from the Southwest Florida Library Network. Over there in the top right is our American Sign Language interpreter, Deb McLean. Hi, Deb. Thank you for joining us for Coronavirus, Hoaxes, Fear, and Truth, How Libraries Can Help. Our presenter today is Dr. Stephanie Rollins. She is a research and writing specialist at the Air University Press at Maxwell Air Force Base and an adjunct professor for the University of Alabama. She teaches digital reference, collection development, and organization of information, among other courses. Stephanie serves on both regional and state library committees and has over 23 years of experience in academic and special libraries. She holds a BA in English from Auburn University, a master's degree in library studies, and a doctorate in public administration, both from the University of Alabama. Welcome, Dr. Rollins, and thank you for being here. Over to you.
Thank you so much, Cindy. Thank you, Deb. Today, we're going to talk a lot about fears and hoaxes and the truth. And throughout my career, whether it's a crisis time like today or something that's overwhelming to me, the best way I know how to fight fear is with facts. And so before we get started, I just want to do a quick check to make sure that everybody's okay. So if you would, I just want to know if my Florida library friends are safe and healthy. So please just type in the chat box and just let me know how you are. I'm just kind of worried about you guys, and I just want to know that you're doing okay. So just while we're getting started, and I'm seeing multiple people typing. Are your libraries open? If so, what kind of level are they open? Fit as a fiddle. I love it. Fantastic. Doing okay. Doing great. Multiple people are typing. Thank you. Thank you for letting me know because I was worried about you guys. Couple of housekeeping things. If you would, take out a sheet of paper. We're going to do a very quick kind of self-help exercise later. I'll get to that in a minute. And you will get a copy of the PowerPoint slides. So if you need that immediately, you can just email me, but you should get that. There's a lot of links in here. Also, I do have my PhD in public administration and my Master of Library Service, but I am not a doctor, and I'm also not a psychologist or a therapist. So, but what I am is an information expert. So I hope that what we're going to go through today is going to help you fight your fears with some information, some places to go, some coping, even though I'm not a therapist. So let's go ahead and look at our actual formal agenda. So today we're going to look at what is the coronavirus, which we're all intimately familiar with right now. What are the current statistics? I just found another great site to look at last night. How are you going to put those in perspective? Because the numbers are kind of overwhelming. And so it's thinking about the numbers and looking at them and putting them in perspective. What hoaxes exist regarding the coronavirus? I just heard a brand new one last night. How can you get automated help and things you can share with your patrons? Why focus on the truth? Why us? Why are we important in this role? Some basic terminology about verification, fact checking, and fake news. Also going to go through some terminology with coronavirus. I just heard a brand new term last night. How can we debunk false information when we don't have these automated sites? What are some methods? And I've got at least 5. You can pick one, and it's things that we've already done. And what news sites can we trust? And so I'm going to go through a couple of those in a way you can kind of get to some great news. What sources can we use to help libraries prepare? Some of you were prepared in Alabama. We weren't as prepared as I think we would have liked to be. So if you're still struggling to kind of prepare your policy statements and different things like that, we'll look at that, some sites for that. Also, some good examples of presenting coronavirus information, some research guides, some different things like that. And then also we're going to look at quickly, this is not new. We've always done some remote services, but how can we market our services to effectively make sure that our patrons are still aware of what we're doing for them online? Again, it's not new. It's just kind of refreshing, maybe a PR article, maybe updating your website. And I've got some great Florida examples of libraries that are doing that. And then throughout, we're going to kind of talk about sources that your patrons can go to, your family, your friends. I typically will link free sites, so everything is free. You can get all the public can get to this, and I typically try to link you to hub sites, so you have a whole bunch of sites at one place instead of linking 50 million sites for you. So that's kind of the plan for today. So what is the coronavirus? Well, you guys probably know that it's called a coronavirus because it looks like a crown under a microscope. And coronavirus is not actually new. There have been 18 before this one in different variations, but because this one was so unique, that's why it's called novel, and it's the 19th one. Some of the symptoms, of course, we know: fever, cough, shortness of breath. It's a respiratory disease. It's spread through droplets, and you transmit it and get infected. Highly, highly contagious. We know this by looking at the numbers. And so, again, during this time, sometimes it can be confused for a cold or the flu or even allergies like I have right now. You can probably sense that in my voice. So if you're not sure and you're feeling bad, you can always call your doctor. Don't just show up. Call them and they can triage you. And then there's also a health call center for Florida, and that's the 1-800 number right there. Um, so, we kind of know what it is, but if you needed further information, there's a million videos out there. This is one that I really liked. I only picked one because she's very calm, explains it very clearly. Within 4 minutes, I had a complete understanding, and it wasn't using a lot of medical jargon. So if you need a video to explain to people. Also, I've got some sites later for how to explain it to kids, because that's a little bit different, right? So we'll look at those. So we just talked about this. These are some symptoms and how to stop the spread, but I just wanted to present them to you to show you the great colors, how simple they are. These are things that are from the CDC that you could share with your patrons, either on Facebook or in an email message, whatever it might be. Not too many though, because you also don't want to overwhelm them. So just great, colorful, simple graphics without jargon. So some of the terminology, and I'm going to share a website with you real quick if you want to follow along. It's also on my slides at the very top. Give you just a second. Let me grab this URL for you in case you want to. And one that I don't have listed here is aerosols. And it might be a little bit different than what you think. So give me just a second, and I'm going to walk through these with you. So aerosols are actually infectious. I mean, when I think of aerosols, I think of a can of Lysol, right? I don't know about you guys. So aerosols are actually infectious viral particles that can float or drift around in the air. So it's emitted, same kind of concept, with somebody sneezes, somebody with coronavirus sneezes, or and even somebody with no symptoms. They talk, breathe, cough, or sneeze. Another person can breathe in these aerosols and become infected with the virus. And they say that aerosol coronavirus can remain up into the air for about 3 hours. Now, one of the hoaxes I heard last night was that it could remain for 8 hours, and that's not true. There's a study done by in the New England Journal of Medicine where they look at how long things can stay on different objects, and it is not 8 hours. So don't worry about that. But 3 hours is still, stay home. Don't go out where somebody might have sneezed. So community spread. It's Our community transmission is said to occur when people have been infected without any knowledge of contact with someone who has the same infection. So you're spreading it throughout the community. You may have heard a lot about contact tracing. That's kind of where somebody's diagnosed and they try to trace back maybe a school, office, restaurant where that person worked, so they can notify other people to make them and hopefully help them quarantine themselves. Containment's our ultimate goal. We want to limit the spread of the illness because there is no vaccine or therapies to treat it. They're working on it. And so it's done using public health interventions like isolation, which means you're by yourself, and tracking down anybody they had contact with and possibly placing them under quarantine. Epidemic is a disease outbreak in a community or region. And you guys know that we're under a pandemic, which is a little bit different. That affects large populations, a whole region, country, or continent. Flattening the curve is also one of our huge goals. This is a kind of simplified version of that. The idea is that with preventative measures, protective measures like staying home, washing your hands, wearing masks, isolating yourself if you do get sick, that you can reduce the capacity on the healthcare system. Um, so that's, again, stay home, stay safe. That's one of the best things that you can do. Incubation period is the time of between exposure to an infection and when the symptoms begin. And with the coronavirus, it can be up to 2 weeks. So Rosa can't hear anything. Can everybody else? I'll keep talking. So again, isolation, we talked about that. That's when you separate people who are sick from people who are not sick. Again, mitigation is one of our goals. You're trying to take steps to limit the impact of an illness. So it may include things like we said, hand washing, not touching your face, staying away from people who are sick, social distancing, again, avoiding large gatherings, and regularly cleaning frequently touched surfaces and objects at home or at a school, work, other settings. Physical distancing is not on my list. It's another new one. It's also called social distancing, and that basically refers to actions taken to stop or slow down the spread of a contagious disease. Basically, it means a minimum of 6 feet. Somebody had all kinds of different, graphics for this. Somebody had put a graphic. It's 24 beer cans, kind of laid out horizontally. Other people have said it's the distance between people could be the distance of a llama. So whatever image you have in your head, it needs to be at least 6 feet. The quarantine is basically when you have somebody who's contagious and or they were exposed, and you basically put them in quarantine to make sure whether or not they're going to be sick. SARS-CoV-2 is short for Severe Acute Respiratory Syndrome Coronavirus 2. And that's the official name, although we go by COVID-19 or coronavirus for short. So those are some terms you may see in the news. Virus, again, that's the smallest of infectious microbes, smaller than bacteria or fungi. And it basically creates a piece of, it consists of a piece of genetic material. And it can survive. It can't survive unless it has a living cell. And unfortunately, the living cell they need is us. And so they can, reproduce and also, transmit. So that's some information about some of the terminology that you'll see. Some other terminology that I didn't mention that are on my slide, I've got a couple graphics for, so give me just a second. Okay, here we go. So one of the things that Alabama and Florida, I think as late as last week, came out with was the stay-at-home statewide public health order. And again, this is to limit the spread, to limit, try to flatten the curve of the coronavirus. And so the article here on the left is an article where it kind of tries to answer some of the FAQs that you might have for Florida. This is for Alabama. We just had it issued as of last Saturday. So things keep changing, but it's got some basic questions here that might be helpful to you, like can I go to church? What about weddings and funerals? Just some basic questions that you or your family might have. Another thing I wanted to share with you, let me post it in the chat box real quick. So some other terms on my screen are, and this is updated pretty good because I just checked and Alabama was on there as having a stay at home. But sometimes you'll see the terms non-essential businesses, which I think we're pretty much all past that. Most non-essential businesses are closed. And those are things like the service industries, things like getting your nails done or, getting a massage or anything that you would think of where you would be in close contact with people. And so stay at home or shelter in place is what it's called sometimes. I think there's only 10 states that don't have that right now, although some of the counties in those states are doing their own thing. And so it's a couple different terms with that. There's called lockdown. And so we don't have lockdown, but China did for a little bit. And the other thing not to worry about is they're not going to call out the National Guard and put, militia, so we have to stay in our houses and can't even go outside. That's another hoax that's being passed around. That's not going to happen. But oh, sorry, there's only 6 states that don't have lockdown orders. And so you just want to practice social distancing. If you do go out, you may want to wear a mask, and I'll talk a little bit more about that in a second. And also, you want to think about, staying home. Again, non-essential businesses are closed. You are allowed to go to the doctor, to the grocery store, to visit a family member that might need you. Those are things you're allowed to do, but pretty much everything else you need to stay home if you possibly can. Okay, so here's another. I don't think I shared this one with you. So this just kind of explains what's a non-essential business, and what's open, what's closed, in case you need it. Some other terminology that I just want to talk to you about really quickly. If you live near a military base, you may have heard that we are at HPCon Charlie. This is kind of some information about the different health protection measures, and that's what HPCon stands for. So 0 is great. We'd love to get back to 0, which is normal. Alpha, which is A, is report of unusual or health risk disease. Bravo is outbreak or heightened exposure risk. Charlie is where we are right now, and we are again being asked to shelter in place, which is the same thing as stay at home, and wear masks and equipment as necessary. So also, one of the things you'll see is sometimes they will talk about essential and non-essential employees. My husband is essential, so he's still out at the base. He's responsible for the facility maintenance, and so he can't stay home. He can't telework, so he's still out there, which worries me. And I know that our nurses, our grocery store workers, our postal and UPS drivers, all those people are still considered essential. Think about that in terms of the different terminology and different things like that. Okay, so you probably know that in the beginning this was 15 days that we were going to stay home, and now it's been extended to the 30th of April. I'm hoping that's all that we have to do. We'll just have to wait and see on that. But these are the president's guidelines, and they're very similar to what's put out by the CDC, and ways that you can do to slow what things you can do to slow the virus. If you are quarantined, these are just some of the things that the experts say that you might need. You don't need to go out and stockpile for 5 years. We do have food. A lot of the sites I'm going to show you answered every single one of my frequently asked questions, whether it's about takeout food or how long something can stay on a package. The coronavirus can stay on a package or whatever it might be. But the one of the things they said is we're not going to run out of food. It's just slow to restock. So depending on where you live. You only need 14 days per person for a quarantine. Other things you might need, bottled water. If bottled water is not great in your area, copies of your health records. You want to be able to entertain yourself. I've got a great website for that later. And you want to prepare for pets and family members. What's your plan? And these are things to have in store just, as a protective measure, things you need to think about. Make sure you have a first aid kit. But if you are forced to quarantine, these are some of the things that the experts say that you need. Okay, so masks. As of about 3 or 4 days ago, I think it's the 5th of April is when I first saw that the CDC was recommending that you wear a mask when you go out. And it talks about how to wear it. They have a whole section of their website about masks, different things like that. I've got a link here. This is by Kate Hudson, but there's a million links out there about how to make a mask if you can't sew like me. I know a lot of people are making masks and donating them, which is fantastic. And that before this, the verdict on masks was kind of, well, if you feel like you need to, and now they're actually advocating it. And in fact, as of starting tomorrow, if you work on a military base, you must wear a mask. If you work on Department of Defense property, even if you are 6 feet apart from somebody, you have to wear a mask starting tomorrow. And they have advocated as of Sunday wearing masks if you can't maintain 6 feet of distance. So all the military on working on DoD property, all military and civilians. So I had to help my husband put together a mask because we didn't have one of those professional masks. So he had a T-shirt that he used, and you can. There's all kinds of websites that you can look at for finding those. I think a couple people are typing. Maybe they're making masks, or they have a website that they like for making masks. No, it's not just for civilian. It's for everybody. And they do have some recommendations. I didn't list them, Cheryl, but they do have some. Uh, there was a memo that came out that I've got in my email box about how it should fit with professional military attire. So it does have to not only be a mask, but it has to be professional, and they've got some standards for that. So thank you for mentioning that. I don't feel like I'm not going to run with a mask, Dana. That's me. If I'm at least 6 feet away from people, I think I'm fine. It's just whatever you feel you need to do, you need to follow that, whatever makes you comfortable. But if I'm running, I'm not worried about catching the coronavirus. Now, if you come into contact with a lot of people and you're walking, and you may want to think about that. So it's up to you. What's your comfort level? You do you. Okay, so there's also, like I said, any kind of question that you might have. If you go to the FAQs of CDC, FDA, you're going to find it. I had some questions about takeout food because I don't. I love to cook, but I don't want to cook every single night, and I also want to keep some of my local businesses open for when this is over. So I try to, get takeout once a week. So I was concerned. Um, about thinking about, well, can I pick up takeout food? Is it going to be safe? And it's very unlikely that you would get it from takeout food. Yes, iris COVID-19 is airborne, um, but it's unlikely that you're going to get it from running. If it's just very unlikely. And I could get some articles for you and stuff if you need to see that, but it's just not. It's just you really need to unfortunately, have somebody cough on you or cough near you for it to, to be air, whatever that word is, aerosols, to get air into that point of being aerosol and projectile, if that makes sense. I'm not a doctor, but yeah, you do have to have it nearby. Okay, so to get to the numbers, and we're going to talk about putting the numbers in perspective because it can be quite overwhelming. So when I did this a few days ago, the numbers, we did have over 1 million worldwide. So that was as of the 5th of April. So just 4 days later, we have 1,484,811,000 for the United States. 88,000, I'm sorry, this is worldwide, 88,538 deaths and 329,876 recovered. So when you're thinking of the statistics, think about the people that are recovered. That is huge death numbers. But think about the people that have survived, and think about the people that are being tested. So we're seeing a lot more people being tested. So we're going to see a lot more numbers and a lot more cases. For the United States, when I just did this a couple days ago, we had 337,620, and now we have 132,000. Again, 14,817 deaths, horrible. 23,906 recovered. For Florida, and again, everything I'm showing you is available to the public. And again, I went through this pretty quickly, but if you look at, let's see if I can get this to show you, down here at the bottom where it says where they got their data sources, it's pretty reputable, but nobody has the total picture on the numbers. It's just their best estimate on the data that they're getting. And they don't always get every piece of data. And that was one of the criticisms of China. Again, give or take whether that's true or not. But thinking about data and numbers. I'm not a math genius. My husband's an engineer and he's absolutely a math genius. And so he tells me, put the numbers in statistics. Yes, Beth, the information does change very quickly. but you can go there, and there's a couple other sites I'm going to show you guys where the statistics are updated like by the minute, but they also tell you when they're going to be updated. So for instance, for Florida, if you look, I don't think you can see this barely. It says this data is updated at 11:30 a.m. and 6:30 p.m. So if you're just concerned with Florida, you know when to look. And so when I do these stats, I run them about 10 o'clock at night so I can make sure I'm sharing the latest statistics with you, but we're also going to go live and look at them. So this is for Florida, and this is when I did it a couple days ago. 12,350. As of last night, it was 15,698, 323 deaths. And I'm going to show you this website because you can actually look at each county, which is great information to have. There's also a new app that I discovered that you can do. It's called Newsbreak. I'm sure there's other news apps out there, but you could set it so it's very local. So for instance, for this, I set it for Bonita Springs, and this data is as of March 31st. I couldn't get quite the screenshots I wanted to last night, but it does give you updates specific to Florida, Florida Daily Update, the world, and global statistics. There's a health and weather map I want to show you, and what this does is it looks at atypical illness and some of the trends observed. There is a social distancing scoreboard, so you can see based on cell data if people are actually staying home or not. We'll talk a little bit about that. This is the projections. This is by the IHME, which you may have heard about in the news. This is what they refer to at the White House and a lot of news articles that they're looking at for, quote, the model of how things are going to go. And so this is another kind of way of looking at the data I'm going to show you. Also, I just found this last night. There's a COVID-19 data project where you can look at in your state and county, and you can also look at your state and county compared to others. Also, the CDC and the World Health Organization have situational reports, so you can look at those. Again, these are just a list of some of the websites here. And so what I'd like to do is I'm going to share my screen with you and just kind of show you a couple of those sites because they are interactive. So give me just a second and I'll be right back. Okay, looks like I've got you guys back. So this, I didn't mention it earlier, but this is by Johns Hopkins University. And so again, you can see everywhere they've gotten their data from. It's an interactive map. So this is for the US. Let me see if we went, let me refresh it, sorry. I think I must have been clicking on the US when I was looking at it. But it will also do world statistics. So give me just a second. So this should be the world here. Yeah, so this is the world. So you can see 1,506. You can click on different countries here. You can click on the US. This map is interactive. You can zoom in. It's taking a little bit of time to load. Sorry about that. So if you did want to zoom in and look at other states, you can click over here and actually click on New Jersey. You can click on the states. It's interactive. So if you have people that live across the country from you, this is the Florida map. And again, you can see the total numbers. But what you can do is you get a little bit more demographic information on the counties. So somebody tell me in the chat box what county you're from, and we will look at your county. I'll take the first person. Multiple people are typing. Okay, so it looks like, let's see who was first. Lee County. Okay, so you can actually click on the map here for Lee County, or you can scroll over here to the right. And this is put out by the Florida Department of Health. So for Lee County, what it does, it'll tell you how many cases, how many are non-residents. It'll also tell you the date range, the average date range, men versus women, how many deaths, how many hospitalizations, and how many hospitalizations were non-residents. So it gives you kind of a little bit of demographic data. If I, Let me see if I scroll down. Looks like Hillsborough. Let me do one more and then we'll move on. Hillsborough right here, 644 cases. Um, you can also get the same statistics here. Collier County, and again, this is freely available to the public. So if you want to look at it, again, it's updated twice a day for Florida. So that may be, let's see, let me click on DeSoto. So tell me, Karen, is if this is what you saw before. It says 19 total cases, men 11, women 8, 3 deaths. So it looks like maybe it's gone down slightly. And that's, again, one of the trends that they're seeing. They don't want to be too hopeful and downplay it, but they are seeing some flattening of the curve. Some of the articles say that, but again, as we'll talk about later, I'd want to look at that actual article and pick it apart and look at their resources, right? Make sure it's actually what we're seeing. Okay. Again, the World Health has got some situation reports. There's one from April 8th, which is yesterday. Like I said, they've got some fantastic media resources. They actually have a section of their site that's got Mythbusters. I'll show you that later. For the CDC, again, they've got a very simply laid out website, not a lot of medical jargon. Again, they've got the symptoms. Here's where I was telling you about that section about the cloth covers. They've also got a self-checker that you can kind of run through, maybe before you talk to your doctor. And then they've also got a fantastic media library. And they've also got, again, like I said, a situation report right here. Another thing to look at is Bing has got another kind of different way of looking at the map. And you can also, again, like I said, look at it by county. So if I click here, it's going to do my county, which is Elmore County. We refer to ourselves as Elmorons. Anyways, so this says we have 24 active cases, which has gone up for us as well. We don't have any recovered cases or fatal cases, and that's one thing to keep in mind when you're trying to put this data into perspective, is that it takes a good 2 weeks to incubate, and then sometimes 4 to 6 weeks to recover. I don't know if the recovery data is always being reported. I don't know if the active cases people are always reporting. So keep that in mind when you're looking at some of the data. So we haven't had a death yet. I'm sure it's coming. But again, you can look at it at the county level. Again, so you can see it kind of breaks it down over here. Worldometer is another place that it just gives you more of a table interface. So you can kind of look at it that way. And you can see, how many new deaths per day. You can look at per state. And it just kind of gives you a little bit of a table kind of information. And then it also gives you kind of a graph. So you can see that we are going up. I also wanted to show you, this is the weather map. And again, you can see kind of atypical illness, as it gets lighter, is better for us. You can actually click on, so this is Elmore County. Let me try Lee County for you guys. So you can again, you can look at it at the county level. And it'll zoom in. And you can see that the atypical atypical illness is moderate, illness trend is steady. If we look at, let's say, if we look at Alabama, my county, which is, again, a lot less people, keep that in mind. So this is Elmore County, Alabama, which is right there kind of in the middle of the state. And if we scroll down, it says, we also have a steady illness trend, but ours is mild. So again, just kind of give you some information. They tell you where they get the data, expected, typical range. Again, they'll tell you about how they got their data. It's going to catch up with me in just a second so you can see that. Okay, there we go. Another kind of sobering, very sobering. This is the IHME. Remember I told you earlier that's where a lot of the White House and the news media are looking at for their projections. So this is looking at the entire United States. They say we have about 2 days until this peaks in the United States. It will also do states, so you can look at that. But it looks at the number of beds needed, the number of ventilators needed, different things like that. So we can look at it for Florida. And when I looked at it last week, it said that you guys were going to be short. But they have looked at some of the models and they've predicted that the total number of people that are going to not make it, unfortunately, has gone down. So again, it's a model, statistics. They're not always right. They're not always wrong. So take it for what it's worth. But it does project how many will die by August 4th. Like I said, very sobering deaths per day. It tells you when they think the most deaths are going to happen. Again, this is all modeling. So think about that. It's not necessarily 100% accurate. It's their best guess using statistics and data that they have right now. And the reason that they saw that the numbers, they predicted the model and the numbers going down is because we have been doing the flattening of the curve. We have been staying home, all those kinds of things. Okay, that's probably my least favorite site because it's very sobering. Again, based on modeling, so take that for what it's worth. This is the one I just found last night. This is the COVID-19 data project, and this is by Broad Street. And they're a company that way back in the times of the 1918 plague, they did a lot of different modeling and things like that. And so they wanted to continue this for this one. So you can look at the total confirmed cases and deaths in your state and county. So again, exactly, Cindy, statistics is probability, not fortune telling. So it's the best probability based on the information at hand. So and it's done by people who are really good at math, but again, they can be wrong. So anyways, this one you can look at your state and county, and you can also look at it compared to other states and counties. So if you look here, you can see Alabama compared to Alaska, compared to Arizona, cases versus deaths, but you can also look at your county. So if we do Florida, we can click on Florida, give it just a second to catch up, and then we can click on Florida again. Well, I thought I could get the counties. Let me see. Oh, okay, here's all the counties. So you can see if we look at based on the different counties. So it's kind of a neat interface because with the Florida Department of Health, you could kind of look at it, but this is all on one page. So again, you can see Hillsborough, different things like that, Lee County, so you can see those. Okay, and then one other thing I wanted to show you, this is kind of rating how we're doing in terms of staying at home. It's called a social distancing scoreboard. And again, they tell you where they got their data from. So right now, the United States has a B minus overall, 55% decrease in average mobility, and a 70% decrease in non-essential visits. So if we wanted to look at Florida, if I go here, click on Florida, and you can also, like I said, you can look at the counties. So if you look, you can see how your county is doing. It looks like most have A minuses, some Bs. Let's see who has not doing well. Baker County, Hamilton County. I don't know where that is, but you can also, like I said, you can look at the different. You can click on it and look at the different counties. When I checked my county in Alabama the last time, we got an F. So I'm going to see how we're doing now. Just to give you an idea of what it looks like. So we have a C minus, so we're doing quite a bit better, but we still only have a 60% decrease in non-essential business visits, but average mobility. And again, they look at cell phones anonymously to get these kinds of statistics. Okay, so this is an article. I'm going to paste it in the chat box because I don't have it listed. But numbers can be overwhelming, absolutely. And I don't want to play light with the numbers and tell you not to look at them and not to feel how you're going to feel. But looking at some of the way the data is displayed can be overwhelming. Something like this map right here at the top, as opposed to this map with the black and the chicken pox looking, it looks dark. So sometimes the way something's presented can also influence how you feel about it. Also, if you look at the different kind of interfaces, if you look at percentages as opposed to numbers, if you look at the amount of people recovered as opposed to the amount of people that have passed away as opposed to the amount of total cases, look at the numbers, look at the statistics. So, again, this one could be kind of overwhelming with the big circles. But again, think about the statistics and try to put it in perspective. Again, statistics are probability, right? And so it may be right, it may not be right. Okay, I'm going to stop sharing my screen for a second. Oh, one more thing I wanted to show you, a couple more things, sorry, this is the Kaiser Family Foundation. It's in my slides. They do a little bit different. If you look at cases and deaths, they can tell you how many, again, looking at the statistics a little bit different, deaths per 100,000 population. I'm sorry, 1 million population. So you can get kind of the numbers on it. So for Florida, so it just, again, a different take on the perspective of the numbers. You can also look at the number of deaths. You can look at the number of cases per 100,000 population, just a different interface. Another thing that they do, they also have people who have adopted social distancing measures. They have cases and deaths trend data that you can look at. So you can actually compare different states. So here I clicked on Florida and Alabama just to compare the two. So you can see that Florida has 236 deaths. Alabama has 64, but you can do a little bit of comparison if you want to. So again, it's through Tableau. They use that site, and so the other thing you can see is what action states have done. Stay-at-home order. So you can see all the ones in black have a stay-at-home order. Again, it looks like 1, 2, 3, those 6 states. You can also see the different limits here. So if you wanted to come back and look at that. I also wanted to mention that Google has a partnership, what looks like with the CDC. Whenever you do a search for coronavirus, it actually pulls
Dr. Rollins, we have lost audio. We can see you, but we cannot hear you.
Okay, I had just had to turn my mic, shut my mic down. It just completely tried to throw me for a loop. Okay, so I was just showing you how Facebook also had some great information there. I'm going to go back to the PowerPoint. Hopefully we'll be able to see that in just a second. At least it didn't throw me out completely this time, which I guess there's still time for that. So what I wanted to ask you, this is part of our exercise that I have for you guys, is what fears do you have about COVID-19? Logical, illogical, you feel how you feel, and that's important. What fears do you have? And I'm going to share mine with you. I've got some ones that I know are not true, not going to happen, but they're still my fears. So oh, asthma, yes, definitely stay at home. Best thing you can do. Wash your hands. So yes, that would be scary. My children as well don't have asthma, but I am worried about them. My grandson, she hasn't been outside for a month. Wow, that would be hard. No cure right now. They are working on a vaccine. I'll talk to you a little bit about that later. Yes, what long-term changes in behavior, definitely, or will there be any changes? Will people just go back to the way they were? Definitely questions. You're afraid they're going to reopen schools, and you work in a school library. I hear you, Beth. Yeah, that's scary. With the virus will mutate. If we'll have a second wave of it, definitely. Yeah, and I don't think this is going to end for quite a while either. My fear is we're going to be in lockdown, which is not going to happen. There's data out there that's not the role of the guard and different things like that. Also, I'm not going to have any food. Not that I'm going to starve anytime soon, let me tell you, but That was one of my fears, and the FDA says that's just not going to happen. In the back of my head, I have this illogical reference to the Walking Dead. That's not going to happen. But it's just you're allowed to have your fears. I'm afraid that I'm going to get sick. My parents, I've seen them 3 times in their driveway in the last 4 weeks. I brought them groceries. What could happen to my parents? Do I think things will go back to normal by fall? I think we have a better chance then. I don't think it's going to be over by April 30th. That's just me. Um, but again, I'm not a doctor. I'm not a scientist. It's just the way the numbers are going. I just don't think we're going to be recovered by then. Now, I'm going to do this on April 30th so you can see if I was wrong. And I'm going to add some stuff to it, to this presentation. So I just don't know. It's too early to say, I think. Yeah, potential raids, yeah, people stocking up with guns. There's so many fears that you're allowed to have right now. And so please don't chastise yourself for having these fears. So how are some ways you can deal with this? And like I told you, one of the things that's always served me well is to know the facts. That can reassure me. I can look at the numbers. I can look and see it in the news that things are happening. They are working on a vaccine, different things like that. Stay away from social media and the TV. Don't have the news on all the time. You don't have to have up to the minute facts. And in fact, when I'm doing these presentations, I look maybe once a day. And I also sign up for newsletters, so I don't have to look at the news every single second. Also, create a new routine. If you can, go outside, walk, make time for yourself, plan out a schedule. I am so blessed that I can work from home, but I found out that I have to make a schedule for myself. Occupy your mind with relaxing hobbies, play the piano, read a book. I mean, that's what started this for a lot of us, right? Is fall in love with reading again. I don't get to read enough. It's very sad. So take this time to do that. This is my grandson on this slide, and I did get permission from his mom to use it. But he's stopping to smell the flowers. So again, having gratitude for what you do have. I am so blessed. I really am. And I know a lot of people aren't. And so the other thing you can think about is getting outside of yourself, and I mentioned this later, and helping people that are less fortunate. Working on your cosplay. Am I saying that right? I know what that is, but I don't think I said it right. But ride bicycles. Somebody said have a dance party. Think about things you can do to relax your mind or distract you. If you do live alone and you can't leave the house, if your child does have asthma and you're worried about leaving the house, do the mobile things we have now. When my husband deployed, we couldn't even Skype. And you have all those opportunities now to do things, through technology. Knitting, fantastic. I don't have the patience, but great. Rollerblading, fantastic. If you do have severe anxiety, please seek help from a specialist. And I'm going to also send you a 1-800 number in a bit. So let me keep going here. Again, find a few sources you trust and stick with them. And we'll talk a little bit more about that later. The challenge is trying to determine which information is accurate. And again, we'll talk more about that. We talked about limiting the frequency of your updates. If you have it on your phone, then you need to make sure that maybe you don't have your notifications set to notify you every 5 minutes. Know when to walk away. You don't have to have every single detail every single minute. And I am a news junkie, so for me it's a little bit hard, but I've managed to do that. And it helps with my anxiety. Name your fears. We already did that, right? We talked about some of those. That's the biggest thing is what are your fears, and we're going to talk about that a little bit more in a second. Again, think outside of yourself. Make a ton of masks for people. The bases and everybody now, everybody needs masks, and you can't find them to buy them most of the time. And people have stockpiled them or stolen them, and they're trying to sell them. So, human nature. What are you going to do? But think outside of yourself in ways that you can help. People that can't get groceries or medicine, or things like doing a webinar for people. That's one way I thought that maybe I could help, was to gather this information for you. If you do seek support, do it wisely. You don't want to talk to somebody who's just going to get you all wound up all over again. You want somebody who has perspective. You do want to pay attention to your basic needs. That means self-care, getting enough sleep, proper nutrition, get outside if you can as much as possible and do some physical activity. There's all kinds of YouTube and apps that do mindfulness and yoga, free stuff. All kinds of library vendors are doing free stuff right now during this time. Gyms are doing stuff for free online. The idea is you want to work towards, kind of understanding your fears and putting them in context. Just like with the statistics, we want to put it in perspective. And center your routine and awareness so you can keep yourself from going down kind of that dark hole. You don't want to do that. And don't chastise yourself for worrying. Your feelings are valid, and you're allowed to worry and feel bad. But again, balance that out. And if you do need help, I'm going to give you some information about that. So when I asked you to take out a sheet of paper, literally this is a 30-second exercise. That sheet of paper, draw a line down the middle, and on the left-hand side, I want you to write things I can't control. And on the right-hand side, I want you to write things I can control. Now we've named some of our fears, and those may be things you can't control. So we've already done part of our work, right? And on the other side, we've already done part of our work because we've talked about things you can do, things you can't control. You can't control the spread. You can't control who the how other people feel. What you can control is who comes into your house, the amount of times you check the news. You can control taking care of yourself. Those are things you can control. You can control washing your hands, right? Those are all things you can control. So the idea is 30-second self-help from somebody who's not a therapist. But I thought this was a great exercise. This is something my husband says to me, not just now, but the whole time we've been together. What can you control? Worry about, what you can't worry about what you can't control. Don't worry about it because you can't control it. And I try really hard, I promise. So yeah, all we can do is everything we can do. I like that one too, Rachel. So, think about what you can control. And again, limit your exposure. Now, for homework, I've got some other things for you. Again, we talked about focusing on caring for others. Sometimes journaling can help. Also, distract yourself. Take an online class. You guys are here in this webinar. It's fantastic that you're doing that. There's like 450 classes out there. Take care of things you've been putting off. Clean out a closet. Do your taxes if you can. Nobody wants to do that. Update your resume. There's a lot of people that are out of work. This might be a good time to update your resume for when you can actually apply for a job. Exercise. If you do have a lot of distress, this is a disaster distress helpline that they set up. It's got a 1-800 number. You can text them. They've also got a website. So you can actually get professional help if you don't have somebody professional that you actually see. This is kind of a way to do that. And then there's not a lot of, great articles out there about coronavirus, reasons not to worry. There's a couple. And so what I just wanted to talk to you about, there's reasons not to panic. I don't want to understate how serious this virus is, but I also don't want to overstate. You'll notice that in Wuhan, they actually opened the city back up. The verdict's still out on that for me, but everybody's wearing masks and they're trying to again track people who've had it. They're doing their best, but that still kind of worries me. I feel like it might be too soon. Again, uneducated scientist, so that's just my feeling. So that was a lot in the news last night. But we do know what this is. We have a test for it. It took them 2 years to discover HIV, but we've had a test in place since January 7th. Situation obviously is improving in China. And so, a lot of times the cases are mild, 80%. Of course, that leaves 20% that aren't. People recover. The symptoms appear mild in most children. There have been a few children that have passed away from it. The virus can be wiped clean, with a 71% mixture of alcohol. And so also hand washing. Science is on it. There's about, last time I checked, almost 200 articles that people are writing about it. There's 8 projects seeking vaccine prototypes, and there's currently 80 clinical trials, and I think that's gone up by the last time I looked at this. But there's some positive news. the guy who runs Microsoft, Bill Gates. He's just paid $1 million or something like that, and they've developed, and this is also in Pittsburgh, separate from the University of Pittsburgh, but they've developed a vaccine, and so they're in clinical trials. Also, the University of Pittsburgh had success with a COVID-19 vaccine in mice, and so they're doing human trials. The thing to think about, though, is it takes a good 18 months usually to do human trials to make sure it's safe. So that's something to think about. There's also a quick test that was approved by Abbott Laboratories. Um, of course, we've got the stimulus bill, so hopefully that'll help most Americans. The cases are slowing in Italy, and so there's a lot of things to not reasons to not panic. There's things to think about that are happening to not panic. And again, I'm not making light of this virus. I like this quote by Martin Luther King because today I think it's still applicable. Our survival depends on our ability to stay awake, to adjust to new ideas, and to remain vigilant. So I think optimism, again, sticking to the facts, but you still have to remain vigilant, and you might have to change a little bit. So it'd be interesting at the end of this to see if people change or they don't. It'd be an interesting study to look at. So talk to you about hoaxes. I'm going to run through a couple of these, and then I just want to go live and show you one of them. Snopes, and again, these are sites that are good not just for COVID, but also for the future when you're looking at hoaxes and misleading information. So this is Snopes. There's also All Sides, which gives you 3 different viewpoints on political issues, kind of checks the facts a little bit. Factcheck.org also checks facts. The World Health Organization has a Mythbusters. I'm going to show you this. The PolitiFact has kind of like an information meter, false, misleading, pants on fire, liar, liar settings. You'll see over here with the Facebook one. And it tells you when you click on it, if your time's short, this is why this is not correct. But if you have more time, here's all the details. You also have the credentials. This is Daniel Funk that you can of the person who's reviewing the facts. Also, NewsGuard is an organization. They also did a webinar. I think I've got it listed at the end as one of your sources. They also did, they're doing a listing of all the websites that put out false information. Pointner, another place that looks at facts and tells you if they're misleading or false or different things like that. And then AFP Fact Check. This is one of the claims that I had heard about gargling salt water. I don't know if you guys had heard that one or not. And so they also check facts. The Department of Defense is supposed to put something together called Mythbusters, especially about things like the militia taking over. That's not going to happen. I haven't seen this come out yet. Maybe they are still working on it. And then the best thing we can do is share facts about COVID-19. So these are some of the sites. Let me just show you. And show you those really quickly. I'll share my screen. Hopefully it won't slow things down too much. All right, because I just wanted to show you one of them. They all do similar things. This is the Snopes website. I'm sure you guys are familiar with, but they have an entire section on the coronavirus. In fact, they have about, I guess it's 12 different topics under it. So you can see different information here. Things about Trump has 2 categories: conspiracy theories. I'm going to click on that one. I haven't looked at that one lately. Okay, so if you look at it, we'll just click on one. Did a Chinese intelligence officer reveal the truth about the coronavirus outbreak? And again, when you click on it, it's going to give you more information. Minimize this a little bit. So it tells you, where what the claim is, the rating. It tells you the origin, where it came from, and different aspects about it and why it's not true. So just again, automated, very helpful, something you could send your patrons to. But we're going to talk about other things you can do as well. So this is the World Health Organization. This is the Mythbusters. All of these graphics can be downloaded, and you can put them on a blog. You can put them on Facebook. They're all images that you can download for free. Okay, so let me go back to our slides really quickly. Just a second, let me get back there. And I have a little bit more information. I do understand if you need to go. It's running a little bit longer than I had hoped. And again, you will get a copy of the slides. Okay, so I think I was talking and you couldn't hear me. I just said if I do have a little bit more information. If you do need to go, I understand. But I do have some information about preparing libraries and information and virtual programming. So if you want to stick around, fantastic. So this is just a little bit of information about if you don't have something that's automated like Snopes, what do you do? And so there's just some terminology about verification and fact checking. The approach of getting the facts and the right facts. And fake news has been really hot lately for librarians, but it's not new. We've had, fake information, misleading information. In fact, back to the time of Octavia and Mark Antony. Um, that gargling with salt does not work, Ken. It does help if you have a sore throat, absolutely, but it does not do anything. It does not kill the coronavirus. Thank you for asking. And if you want to go back and look at that, you can. It'll be in the slides. But again, fake news, fake information is not a new problem. There's some terms here you're probably familiar with: clickbait, when they want you to click and it's actually not a really great article; hoax, we've seen some of that; misinformation; filter bubble. I'll talk about that for just a second while I pull up the next slide. When you do a Google search or you log into Facebook, you're kind of in this filter because it curates information for you based on the things that you like and based on the things that you've looked at. So during this time and other times, make sure that you look at things you don't usually look at because you're only getting a certain filter, what they call a filter bubble on information. So I would just strongly advocate that for you. But how are we, type in the chat box if you feel like sharing, how are we equipped to be the ones, not just during this coronavirus time, but other times? Why us? Why are we helpful with this? And a couple people are typing. And I'm going to tell you why, but I know I just wanted to hear from you guys too. We know how to evaluate information, whether it's about, yes, people trust us. We can build collections and programming that focus on media literacy, absolutely. And this is a great time for it, right? This is, it's in the news, coronavirus is in the news, and we can help our patrons. Again, we're advocates for skepticism. Also, we have all these things that we can put together, whether it's your Facebook page or a research guide, LibGuide, or hands-on activities. There's all different things out there we can help. We're experts. We're part of their lifelong learning. One of the things that struck me, I only pulled 2 graphs. Again, statistics, you need to look at it, verify it. But 89% of people either get news from news websites, or apps or social media. And remember how we talked about that filter bubble? So a lot of it is filtered for them. And this is from the Pew Research Center. So think about that in this time. Yeah, so we can show people what they don't need to know. Absolutely, Karen. And also, 1 in 4 people report sharing fabricated news, whether aware at the time or not. It happens. And it's important because people deserve the truth. It can destroy their credibility if they send out stuff that's not true. Right now, especially with coronavirus, it can hurt you or it can hurt a lot of people. If there's people are putting out hoaxes and different treatments and things, people can die because they're trying, mosquito drug treatments, and they shouldn't be. And the truth can only benefit you if you can get to the truth about coronavirus, truth about stocks, bonds, whatever it might be. It can only help people. So also, kids today, they can't spot a political ad from the truth. This is a study they did, so another reason to think about it. So I've got about 5 different methods. This is not new to us. It's just kind of how to look at something and see if it's true. Some things you can check, kind of some different checklists. One of my favorites is escape news. This is geared more towards kids. But it's asking those questions that are kind of just, in our heads already. This is what we do. What's the evidence? Do the facts hold up? Who made this? What's the big picture? Who's the audience? And why was this made? And then how was it executed? Does it have a lot of grammatical errors, different things like that? One that's more academic that's been around forever is the CRAP evaluation, right? The currency, the relevance, the authority, the accuracy, the purpose. And this one actually gives you kind of a score that you can look at based on answering some of the questions here. This is new to me. This is kind of part of my job. I do a lot of things with looking at journalism as well. So this is free. It's a free handbook. It's called the Verification Handbook, and it's the definitive guide to verifying digital content for emergency coverage. So very timely. I looked at this way back before we even had the coronavirus. So different emergencies, weather, different things like that. It's a very helpful handbook. Now, PolitiFact also came up with this list of misinformation handbook for epidemics. I think it's a fantastic list. I mean, if it's something you could post on your website, or you could post it. It's the website's right there, Iris, the verification handbook, and I also listed the website in my slides, so you can get it. If you just Google it too, you'll find it. It's super easy. But again, the misinformation handbook, learn the basics of the disease. We've done that already. Be very wary of claims. Again, hoaxes and misinformation. We've looked at that. We want to verify images and videos. I'm going to give you a really quick run through on that. Besides looking, doing our checklists that we've already done and looked at, there's also some sites for that. Beware of attempts to downplay or, on the other hand, amplify the threat of the disease. And again, don't share prevention or treatment methods without consulting official sources, like the thing about gargling. You probably want to check with the doctor, make sure. And look for what's still unknown. That's all the things that I think about when I look at the numbers, when I look at the graphs. There's still so much unknown. Okay, so if you want to think about the news, and you can take this media bias chart or leave it. It's been helpful to me. Somebody's actually taken the time to rate the news and look at, is it just fact checking? Is it skewed? Does it just do analysis? All those different things. And if you kind of drill down a little bit, you'll see that at the top, original fact reporting that seems to be neutral or biased. Again, you still have to look at the article itself. AP, NPR, ABC News. You'll see a little bit further down, original overall source reliability, Washington Post, New York Times. So when I look at the news, these are some of the places I go to. Time Magazine wasn't on there. But for the coronavirus, these are all sites that I've looked at. I get a newsletter from. You can sign up for daily updates. And so this is kind of what I rely on for my news. And again, Washington Post, New York Times can be a little bit critical of the administration, but that's, again, your filter bubble. You need to look at stuff that's outside of what you think about. Okay, so there's a couple of sites I just want to show you real quickly. This is Whois Lookup, and you can look at a website and see if it's, pinging all over the place. And another one is called Spy on Web. So, you can always go through your checklist, but you can actually look at the website itself. Another thing, people can be whoever they want to on the internet, right? They can also post fake Twitter feeds. And if you look here, this is a tweet that I generated, expert medical advice, Dr. Stephanie Rollins. Did you know taking a bath can help cure the coronavirus? Cures for coronavirus, hashtag. So you can also become a complete other person, fake person generator, and it goes into extreme detail. So yes, we've got our professional directories. We can check on somebody's medical degree, all those things. But just verifying that somebody actually exists, period, is a good first step. So I've got some websites for you here. Some you're probably familiar with. WebMe had a completely different interface that I wasn't used to. And these are things outside of Google and outside of Bing. These are things you can look at. Also, PQ. White pages will give you a ton of information. At some point, they want you to pay. But before you get there, they give you a ton of information. Also, LinkedIn, again, anybody can be anybody on the internet, but I think with LinkedIn, it's a kind of a better verification process. And if you look, I was not logged in, and I was able to get a ton of information about me just by looking. You can also fake the news and the weather. These are two posts that supposedly I posted. You're under LinkedIn under a false name. Oh my goodness, Beth, how amazing! So yeah, you can fake it, right? So you'd want to look at other sources most definitely to make sure that you exist. Wow, that's kind of kind of kind of scary, right, you guys? So with the weather, there's a weather underground history, and of course you guys know about Google Earth. So I had posted that I got stuck in the library in February and that I had to spend the night. And that was actually true. This is weather underground history. You can see precipitation on the graph here. However, I had posted that I had mountains in my view outside my window, and you can see from Google Earth that where I live in Wetumpka is very flat. Lots of trees, but very flat. So those are other ways you can look at it. You can also reverse image things. You can see this slide here that has Michelle Obama, an immigrant is taking my job. So somebody has altered the image, which actually said, bring back our girls. Also, there's this video that's been out for a while about a snowboarder girl chased by a bear. So there's ways you can also check images. These are a couple of them right here. Veracity, Google Reverse Image Search, and TinyEye. Amnesty International YouTube Data Viewer. And so you just take the image. This is the app right here that you can take it and it'll look and see where your image first occurred, everywhere your image occurred. Same thing with Google Reverse Image Search. And then TinyEye just started using not too long ago, but you can actually drag your image in. You can upload an image just like the other ones. But you can also do a sort by oldest. So I was able to find the original picture of Michelle Obama, and and I was able to go to that site and verify that was true. Not the one at the top was not true. Also, the Amnesty International YouTube Data Viewer, it separates clips from the video, and you can reverse image search them, and you can see that in some of these clips there is no bear. So that was absolutely false. So real quick, in this, we went through some things really quickly. I know you would Google him, but does this doctor exist? What are some things you might try? And you can just type it in the chat box. We'll just take 2 seconds because I want to move to stuff that's going to help libraries. But what would you do to check to see if this doctor actually existed? I can give you a clue. The biggest thing on this page is the picture, right? So one of the things you could do is take it and run it through TinyEye. And what you would find, yeah, absolutely sure. What we'd find immediately that this is a stock photo of a lonely man in church. So that would give me doubts as to the rest of the information. But I could also look up his phone number and see if the phone number actually exists. I could look in professional directories. Yeah, why is he sitting in the church? Absolutely, Beth. Okay, so these are some resources, Digital Resource Center, there's Common Sense Media, all kinds of courses that you can advocate, LibGuides, all kinds of LibGuides you can search for, and you don't have to reinvent the wheel if you want to do something for people. And then here's a link to that verification handbook right here. So what I want to move to next is 3 areas. The first one is going to talk about how libraries can prepare if you're still kind of trying to get your policies out and you need help on information. The second area is examples of people that have provided information on coronavirus and some examples of that. And then the third one is on kind of reminding people the services they still have. And I want to show you some examples of Florida libraries that have done that. So I'm just going to go through these quickly, and then I'm going to go live and show you a couple of sites. Yeah, Google is great. It's just sometimes I found things in these other sites that I didn't find in Google. And it could be it was on page 20 of Google. So again, thinking about different sources that you can use, absolutely. So this is some things to help libraries prepare, whether it's your policy response, whether you need help from public libraries or academic libraries, whatever it might be. So this is a guide to COVID-19 for public libraries. This first one, I'm going to show it to you. It's from NLM. There's a pandemic preparedness guide from the American Library Association. Just type in the chat box if you've heard of any of these. Library Journal has a fantastic series of articles. They've even got an article just lately I saw about how to disinfect your materials. There is a disaster planning and community resiliency guidebook, which also has some policy statements you can adapt for your library. So does ALA. Also, PLA resources on COVID-19 from the PLA Board of Directors. There's two sites I'm going to show you. One's from Oregon libraries, one is from Massachusetts libraries, and these are resources they've prepared to help other libraries. And Oregon's probably my favorite one. I'm going to show you that really quickly. Also, some marketing tips during the coronavirus threat. This is an article and some resources. If you are open or closed completely, some questions to ask whether or not to stay open. And then if you would, there is a Google Doc out there called Library Responses to the COVID-19 Pandemic. And every library that's closed, whether it's the technical staff still working, whether or not people are doing, pickups at the curb, whatever it might be, they've put their status in this document. So for Florida, it might be a fantastic thing for you guys to update there instead of trying to reinvent the wheel, having lists kind of thing on the FLA listserv, which is great way to share information, but this might be a way to kind of formalize it. Somebody's really optimistic in Connecticut. They've got information on preparing to reopen, because at some point you are going to have to reopen. So if you're still struggling with preparing to close and your policy statements, as you're working on that, you might also want to think about your plan for reopening. Also, there's a bunch of Facebook groups that I subscribe to, and I get all kinds of fantastic advice and websites and different things. So you may want to become part of them. ALA Think Tank, Librarians are Champions of Healthy Communities, libraries and social media, especially for virtual programming. There's a lot of talk on chatter on that one. Also, Sanity Matters. Instead of having 50 gazillion sites, they've got they list sites as well. And then Learning Librarians is a great group for school librarians and teachers. So I didn't want to give you every single Facebook group out there. Those are just some of the ones that I like. There's information for academic libraries supporting teaching and some different resources there. For school libraries, if you're starting to teach online, you've never done that, this is kind of a way to help you get organized. There's some information from the U.S. Department of Education. Probably my favorite resource is the Amazing Educational Resources. This is a list of everything that, not everything, but most things that are free that companies have put out. Also websites, things you can do, and they also have a Facebook group that I subscribe to. There's an article by two school librarians from School Library Journal. Oh gosh, my phone's talking to me. Clearinghouse on Coronavirus by two school librarians, an article. That I mentioned earlier that there's some things just for kids, how to talk to your kids about coronavirus, and a comic that they can make and fold. There's also a brain pop video for kids. Florida Atlantic University has a homeschooling guide. I'm going to show you that. I didn't put the link here for Goleta Valley Library. I'll get that to you. I'm going to show that to you. And then also Zoom is offering free services right now. There's also, as opposed to getting help for libraries, there's information guide examples out there that are fantastic, so you don't have to reinvent the wheel on presenting coronavirus information. So this is a Google Docs list of guides, LibGuides, research guides, if you're not familiar with the term, on coronavirus. However, there's also a LibGuides community site where you can search for coronavirus guides, and you can do it by different type of library. And then the Oregon City Library is a great resource for presenting information. And then these two college libraries, Clemson and UC San Diego, also present information on coronavirus in a great format. Also, if you don't have a research guide, you just want to blog something, there's a couple of resources there. There's also just an article on misinformation that you could post. And then what I wanted to mention last is that we have always done this. We've always offered remote services at one level or another, even if it's just, hey, you can call in and get help, right? But I think we need to remind our patrons about the things that they have available to them virtually. We just need to remind them that they can chat with the library and they can get ebooks. We have library databases. I mean, now's a great time to promote the Florida Electronic Library. You can still do things like have a virtual tea, like you could have a live Downton Abbey virtual tea, right? Take advantage of your social media. I know some people have trouble because like Facebook Live doesn't do captioning, but record it, put it on YouTube. Also things like book club or streaming story time. There's all kinds of things that you could do. Okay, so what I want to do is show you a couple of things and then show you some examples of Florida libraries. So give me just 1 second. I'm going to share my screen and probably under 10 minutes. Okay, so this should be coming up. Okay, so this is from the NLM, the National Library of Medicine, and it's a guide to COVID-19 for public libraries. Again, they've got some sources there for you. This is the pandemic preparedness site from ALA. So they've got a bunch of categories here: news, library responses, again, if you need to draft a policy, tips for what to include, also professional development and training resources. I keep checking this to see if there's any kind of new webinars, resources, federal and state, and some additional resources. So again, a hub. I didn't want to give you 50 million sites. This is PLA resources on COVID-19. So again, they've got a new webinar on the 22nd of April. I believe I have this listed. Again, they've got some information here, some statements that you can reuse, that kind of thing. So this is remember I told you there were libraries that were trying to help other libraries. So they've given you, again, this is from Oregon, but they've given you some resources for responding. So they give you some websites, again, not having to reinvent the wheel. Again, they list webinars and training. This is more specific to Oregon, but it could be something that you could look at. So for instance, this one is today on mental health in public libraries. They also talk about offering remote library services, and this is what I'll talk about at the end. But again, what are some ways or some ideas? Make a video about how to access the library's digital resources, patron tutorials, dial a story option. So again, things that could help libraries. There's also CE resources for library staff. There's also self-care and work. And then they've also got some economic impact resources. So just some things to help libraries prepare and manage the stress of library work during this time. This is the one I told you about that was kind of forward thinking. So as you're doing your planning, again, think about how you're going to reopen, because it is going to happen. I'm optimistic here. Also, this is support for academic libraries, some publications and webinars, things to help academic libraries. Also, if you're supporting COVID-19 and online courses and other resources, this is a site that gives you information about that. If you need help from the Department of Education, some things about waivers, different things like that, fact sheets, that's from the U.S. Department of Education. If you're going to do some homeschooling, again, like I said, this is from Florida Atlantic, this is from your state, and they've got some really good sites on how to get started, the different subject areas, math and science, social studies, and again, it's just a guide they put together to help libraries. This is the one I was telling you about. I didn't put the link. I'll put it in the chat real quick. And I'll make sure it's on the slides that you get from Cindy. But this is, I thought it was fantastic. Again, it's a hub, but these are things to keep busy at home for all ages. So activities for adults. We see a lot of things for kids, but not necessarily for adults. So they've got a ton of things here you guys can see. Again, not reinventing the wheel. If you do need again, the amazing educational resources, this is a list. It's updated every few hours. They're going to launch a searchable website soon, hopefully, because it's kind of a spreadsheet-based thing right now, alphabetically. But it's got a ton of resources here. This is listed on my slides, and they have a Facebook group, so you can see everything that's free right now being offered. Also, LibGuides, like I said, you can do a search for coronavirus. And again, you can look for a guide that's based on your type of library. So let's say you're a K through 12 school library. You can select research guides from that type of library. And so you can see here's year 9, continuous learning, uh, 10 science. So you can see there's information here. Again, the idea that you can use this to kind of create your own type of information. So again, this is one of the libraries. This is the University of California in San Diego. And again, it's just a way of looking at presenting the information. They've got the JSU chart here. They've got resources. Again, the idea of libraries presenting information on coronavirus. So what I want to switch to now is how have libraries responded and adapted their sites or their blogs or whatever it might be, PR, to address the coronavirus during this time. And so I'm going to show you some sites in Florida. I've got a couple of sites listed that aren't in Florida, but I thought were great examples. But it can be something just as simple as, here's our continuity of library services guide. But also, hey, here's academic resources during COVID-19 situation. Here's how you can still use us, getting that message out to people. So that's an academic library. Another one is the University of South Florida. I really like this one. I like all of them, but this one, they do both. They give you their continuity guide, and they tell you how you can still use the library online. And they also, what they do that's great is they have a fantastic hub. Let's see if we can get back real quick. COVID-19 hub of information. And so they list the statistics from the Florida Department of Health. And then what they also do is down at the bottom, I'm not sure if this is going to come up for us. They also, link to all the reports that we've talked about earlier. And then they also link some databases, and they have Twitter feeds. Here's the JSU map again. They have Twitter feeds from the different organizations, the tweets from CDC, University of South Florida. So I think it's a really well done site for the, not just, hey, we're still here to help you online, but also here's information about the COVID-19. This is from the Hillsborough Public Library Consortium, Cooperative, sorry. And I really love this graphic here. Visit the library from home. It's open 24/7 for you, learning and fun for all ages. So again, just reminding people how they can access our fantastic resources from home during this time. This is one from Nova Southeastern University in Florida. And I really like how they feature the people, the teachers here, Miss Lisa, Miss Kristen, but they also have, teacher resources, do-it-yourself story times, tools for teens, fun games. Again, kind of a website to help with that. Read alouds, different things like that. Also, kind of a special medical library. This is the University of Florida Borland Library Health Center. Again, they do a really good job. Our doors are closed, but our services continue. And sorry about that. COVID-19 resources. So again, they do kind of both aspects of that. Not just we're here for you, but also here's information about it. And then last but not least, this is from Alabama, and it may merit just a simple blog post or article on your Facebook page. This is called Libraries Online Treasure Trove Shine During Shutdown. Great title, right? And they show you some of the favorites. You could highlight from your library specifically or from the Florida Electronic Library, and they tell you, the things that you have open to you during this time. So I just thought it was kind of a fantastic way to do that. This is just real quick. Again, another reason not to panic. Hopefully this will come up for us. Maybe not. It says that U.S. coronavirus deaths past 14,000, but future projections are better than expected. So again, another reason not to panic. I'd want to check out this article based on some of the stuff we talked about, right? But it does say that things are getting a little bit better. I'm going to stop sharing my screen. I want to go back really quickly. I have maybe about 2 minutes left to talk to you about things. And I will Okay, and I will get this PDF to Cindy of the sources right after the webinar so she can send it out to you. So these again are some of the sites that we looked at for, again, kind of that virtual programming aspect or just a reminder of remote services that we have. Can you guys hear me? Hello? Okay, so again, this is just a quick review of some of the sites that we looked at, a couple of other sites you may want to go to. And then just lastly, there's some training coming up, and I list those, but I've also listed the training that they've already had. And again, you'll get a copy of this, things that are recorded or soon to be recorded sites. So a bunch of training out there that you can go to. And if you have the time, right? So just moving forward, I said from the beginning, fight facts with fear. So know the facts. You know, stick to a few sites that are helpful to you that you trust. Have some cautious optimism. You know, use some of the strategies that we talked about today. Fact check like nobody's business, right? We want to check our facts, especially right now with coronavirus. Consider multiple resources, not just the ones you usually go to. Be skeptical, verify as much as we can. We can't verify everything right now. Things are moving too quickly, as somebody said earlier. And then share these skills with our patrons, whether it's an article or something on your website, all those kinds of things. And then hopefully, at some point soon, your library will be open again. You'll have those open signs on, and we can go back to work. And if you have any questions, specific questions I've had as I've been doing these about, you know, what about cancer and the coronavirus? And what about employment? Whatever it might be, please don't hesitate to contact me directly. If you need the presentation today, right this second, you can email me. I'm going to make it into a PDF and I'll share the link on Google Drive. Please let me know if you have any questions right now. And again, apologies for going over. There's quite a bit of information here. And I thank you so much for coming today. And please, please stay safe, stay home. And when we do this again on the 30th, I'll have updated a lot of information.
Thank you, Dr. Rollins. That was a really great webinar. And thank you to our ASL interpreter, Deb McLean, and to all of you out there. We appreciate you spending time with us. Please be safe. Have a very good rest of your day. And I hope your weekend coming up is just fantastic. And I'm going to stop the recording now, but we are going to keep the webinar open for those of you who have questions.